歡迎各位出席。
Welcome to today's press conference on the update of COVID-19 as well as various social distancing and anti-epidemic measures. We have with us the Secretary for Food and Health, Professor Sophia Chiang, Secretary for Education, Mr. Kevin Yang, Director for Health, Dr. Constance Chan, Chief Executive of Hospital Authority, Dr. Tony Ko, Head of the Communicable Disease Branch of the Center for Health Protection, Dr. Shang Shukwan, as well as Dr. Linda Yu of the Hospital Authority. We'll first hear from the Secretary first. Welcome to today's press conference. Good afternoon, everyone. Update of COVID-19 as well as various I'll give you an update of the development of the epidemic as well as the latest decision made by the government. You may know in the past 2 weeks, that is between the 21st of December to the 3rd of January, we've recorded 812 cases. Over 90% of them are local cases. Local cases with an untraceable source account for about 1/3 of the total number of cases. The 7-day moving average number of local cases, as I have shown you in this slide, is 15. If you look at the 7-day moving average, is 47, that is. It shows that there is still active hidden transmission chains in the community. Local real-time effective reproduction number has dropped to below 1. However, the extent of the rate of the reduction is rather low. As you can see from this slide, there is a decreasing trend. The line in yellow, the 7-day moving average number is a 7-day average. If you refer to the blue line, it's local cases. Counting from the last 14 days, we see that it is decreasing at a decreasing rate. The line in red is indicates untraceable cases. It is decreasing, but it is decreasing at a decreasing rate. Just now, I have mentioned about the effective reproduction number. It is currently under 1. But we have to look at the situation as a whole. The rate of reduction is slow. Since the 10th of December, the government has tightened social distancing measures to the most stringent level since the last outbreak. They continue from the 24th of December. So far, it's been 3 weeks. As I said, the number of cases has started to drop. If we compare it to the last outbreak, the rate of reduction is slower. There is still risk of a rebound. From time to time, we hear about large-scale cluster outbreaks. The situation is worrying. At the same time, after months of abiding by various social distancing and anti-epidemic measures, there is anti-epidemic fatigue. We can see that over the winter solstice, Christmas, as well as the New Year holidays, there are a lot of people still out and about in the streets, and there are quite a number of cross-household gatherings. If we look at this slide, which is the trend of octopus mobility data, is data compiled by the Hong Kong U. We see that the extent of reduction in number of trips by citizens has dropped. This shows that people have had cross-household gatherings in the past week or two. We can tell from recent outbreak of cases. There are cases involving 3 generations of family members and gatherings of over 10 people. We'll have to closely monitor the situation to see if the situation will rebound in the coming 2 weeks. At the same time, the epidemic situation over the globe is quite severe. We see that the number of cases in the UK, Japan, and South Korea hitting record high. There is a high transmissibility in relation to the variant of the mutated virus strain. So we have to stand guard against imported cases. We have adopted the most vigorous measures in place. In the past 2 weeks, we have successfully stopped imported cases from the UK and from South Africa. And they involve the new variant. We will continue with our vigorous measures to stop imported cases. We are determined to achieve zero infection. Given the fact that the global situation is still severe and the rate of reduction of number of cases locally is still slow, we don't have the condition to relax any measures. We'll continue with the existing measures till the 20th of January. The Secretary for Education will speak about face-to-face classes arrangements for primary and secondary schools. I do understand that trades affected as well as people who are affected by the epidemic would very much hope to resume their normal everyday life as soon as possible. But we do see that given active transmission chains in the community, if we relax any measures, there is a very good chance that the epidemic situation will come back even more vigorously. I hope that people will be more understanding and be more patient. Given the current situation, the chance of relaxing any social distancing measures before the Chinese New Year is low. If there is an increase in number of cases, we don't rule the possibility of putting in more stringent measures to further reduce flow of people and gathering. Of course, apart from social distancing measures, we have other measures in place to stop spreading in the community. You have heard about a number of mandatory testing notices we have issued. We have also enhanced our work in relation to tracing close contacts. In order to support the Department of Health to find, interview, and contact those who have been affected and to make arrangements for them to go to hospitals, as well as to identify close contacts and send them to quarantine centers, we have made arrangements for secondment to the teams responsible for tracing contacts from other government departments as well as discipline services. The Food and Health Bureau is currently working with the Innovation and Technology Bureau as well as other relevant departments to develop an internal information platform dedicated to tracing close contacts. It will make use of existing information system as well as information systems in various government departments and organizations to centrally collect necessary information to trace contacts. This will speed up the work of the Department of Health in tracing, in testing, in quarantine, as well as medical surveillance. We do need a lot of manpower. The Chief Secretary is now currently leading a cross-departmental task force to enhance and implement our work. On testing, since the start of the fourth outbreak in mid-November, between the 15th of November and the 29th of December, the government has already conducted over 1.6 million tests, including over 510,000 mandatory testing. They cover everyone who is mandated to go through testing. There are also over 540,000 necessary testing, as well as over 550,000 voluntary testing. We will continue with our work on mandatory testing and try to achieve zero infection in smaller communities. We have expanded the scope of mandatory testing, especially in relation to residential blocks. Starting from the 30th of December, if there are unrelated cases involving 2 or more units in a building in the past 14 days, they will be included in the mandatory testing notice. Anyone who stays in such buildings for 2 hours or more in the past 14 days will have to go through mandatory testing. As said yesterday, altogether 47 building blocks have been included in the mandatory testing notice. We have also made arrangements for testing service providers to set up mobile sample collection centers near these buildings under mandatory testing notice to facilitate residents or people who've been there to receive the tests. Apart from these mobile sample collection centers, currently standing at 30 in number, there are other ways for people under mandatory testing to do the test. Between the 31st of December to the 2nd of January, in these 3 days, there are about 38,000 people who have done the tests under mandatory testing at these mobile testing centers. We will continue to expand our work under mandatory testing, necessary testing, as well as voluntary testing. We'll provide more convenient services to encourage people to receive tests. Our measures have been somewhat effective. We see that there is a drop in number of confirmed cases, albeit at a very slow rate. However, there is still quite some distance from zero infection. Whether the situation is going to deteriorate, to plateau, or to improve in the coming few weeks, it depends on whether you can all exercise restraint to avoid cross-household gatherings. Of course, government measures are equally important. We appeal to you to keep social distancing measures, to practice good personal and environmental hygiene. We'll continue to monitor the situation to make adjustments. Thank you.
Secretary for Education, Mr. Calvin Young. Good afternoon, fans of the media. And just now, the Secretary for Food and Health just explained the 2019 COVID-19 pandemic is still fluctuating, and the government have just announced that the social distancing measure for another 2 weeks, and the schools shall cooperate as well. The Education Bureau just announced that all the kindergartens and primary and secondary schools, including special schools and schools providing non-local curriculum, shall continue to suspend face-to-face classes and school activities. And with the expiration date from the 10th of January extended to the start of the Chinese New Year holiday in schools, so that they will allow schools and parents to make longer-term planning. We'll understand that the prolonged class suspension would have a certain impact for the student learning, and also know that the school hope to maintain certain amount of face-to-face class time, and therefore in this period, on the prerequisite of maintaining infection control and a limited extent, and based on the school needs, and allowing small number of students returning school for face-to-face classes. Currently, only Form 6 students are allowed to be back in school, and the primary 6 students can return to school for their exams. And from the 10th of January, the school can also extend the arrangements to cover other school grades. For secondary schools, and the school can arrange certain grades, including from Form 1 to Form 6, to returning to school for half a day, AM or PM face-to-face class or exams. And for the whole school, and they have a maximum of 2 sessions of half-day classes, and the number of schools for each session will be capped at 1/6 of the maximum capacity. In order to prevent the student from leaving the school for meals, the schools cannot arrange the same grade of students conduct full day of classes or exam. In other words, the morning or the afternoon sessions students must belong to different grades. For primary schools, and schools arrange some of this grade, for example, primary 1 to 6, and to conduct no more than half a day of face-to-face classes or exams in the morning. We do not suggest the school to arrange learning or other activities in the afternoon for the students. And the number of students allowed will be capped at 1/6 of the maximum of the student population. As for the private school offering non-regular courses, the tutorial schools can allow small number of students for not more than half a day of face-to-face classes. And at the same time, the number of students allowed will be capped at 1/6 of the maximum student population. The kindergarten shall continue to suspend face-to-face classes. We encourage kindergartens to adopt different learning and teaching models and to design learning activities suitable at home in maintaining the student learning enthusiasm and curiosity. And the special schools can make reference to the regular school arrangements and depends on the needs and the condition of these special needs students. So in deciding the details for the resumption of face-to-face classes, and for those schools in special circumstances getting discussed with the EDB. And in this period, the EDB have been communicating with the stakeholders. Fighting the epidemic is a protracted battle, and therefore we should not let off our effort in fighting the virus. At the same time, under safe conditions, we hope the students could have the chance to interact with their friends and their teachers, which is very important to their personal growth and social development. The above arrangements have taken into account the needs of the schools, students, and parents, and trying to strike a balance between fighting epidemic and student learning. The EDB have launched a targeted group testing for school staff on COVID-19 shall continue, in providing free one-off testing for kindergarten, including kindergarten and child care center, primary and secondary schools, and special student schools, special needs school staff. And we also will notify the dates on the school testing later, in providing the health of the students and the other staff, and also to reduce the risk of schools and community transmission. Once again, we strongly appeal that the school staff to actively participate in the targeted group testing. Once again, to EDB, we'd like to thank the school staff, parents, and teachers for their dedicated effort in fighting the epidemic and actively cooperate with the government in infection control measures. The pandemic is still at a very critical moment. We hope that everyone can continue to work hard in maintaining personal hygiene when you're in school, and please remember to wear masks at all times on campus. Wash your hands frequently. If you feel unwell, even for very mild symptoms, you should not return to school and should see a doctor as soon as possible. The school continues to comply with the health guidelines issued by the EGB and the CHP. And make sure the campus is clean and safe, and also making appropriate as to maintaining a school hygiene and safety, and also make suitable arrangements for learning at home. Thank you, Secretary. And now, Dr. Chiang Shuk-Kwan, please. Last night we have confirmed 53 cases. The case number is 896629018. For the 53 cases will include 23 male and 36 female, aged between 1 to 76 years old. 18 of those were detected in the temporary testing centers. Of the 53 cases, 10 of which are imported cases. 43 of those are local cases. For the local cases, 6 of which are untraceable sources, and 37 of those are related to other cases. Of the 37 cases, which included 11 related to the Lam Tin Chunkan Old Tunnel construction site cluster, and the other 26 cases are related to other cases. Of the 11 together with one early cases, the Chunkan Lam Tin Tunnel construction site have a total of 12 workers infected, and they're mainly scaffolding, waterproofing, or minor works or foreign workers. now suggested the site to suspend their work, and all the workers should get testing on a compulsory basis. And the cases 2 days ago, or the case from yesterday, one of which 8937, a chronically ill female patient. And on the 28th of December, she went to the Princess Margaret Hospital daycare medicine ward for treatment. And we was aware that during her stay, and there's some contact tracing at the staff at Princess Margaret, and we found there are 4 preliminary positive cases. We included 2 patients and 2 healthcare staff. The Dr. Linda Yu will elaborate later. And we think there's a transmission inside the hospital. We suggest that for those who have been to the daycare ward EG from the 28th of December and the 4th of January would be required to undergo compulsory testing from the 2nd to the 4th. If you've been tested in these 3 days, you will assume that you fulfill the requirement. And we'd like to offer an apology. The over 40 building list included in the compulsory testing notice, we have included 1 building by mistake. One of which would be Kwai Chung Wafeng Gardens. It mixed up at another building of the same name in Chiang. And therefore, this Kwai Chung Wafeng Yun and mistook as a building subject to compulsory testing. As we note that the 2 buildings have 1 unit with an infected case and actually do not fulfill the criteria for compulsory testing. And yet, we already issued compulsory testing, and today is the last day. For those who already been tested, this is still okay. And due to this mistake, the government will not conduct any enforcement on these 2 buildings. And that's the end of today's report. Dr. Linda Yu from Hospital Authority.
9點鐘
As at 9 a.m. in the previous 24 hours, the HA has recorded 69 cases. In the previous 24 hours, 1 patient in the public hospital has passed away. So far, 147 patients have passed away. In the previous 24 hours, another 44 patients have recovered. So far, 8,054 confirmed and 1 probable cases patients have recovered. So far, 728 confirmed cases staying in 23 hospitals, as well as the Community Treatment Center and the Asia World Expo being treated. 50 of them are in a critical condition, 45 in a serious condition, 633 in a stable condition. Currently, in terms of negative number of negative pressure beds, there are 1,259 with a utilization rate of 63.1%. In terms of wards, there are 691 of them with a usage rate of 72.9%. I'd like to report about the case in Princess Margaret Hospital. A patient visited the daycare medicine ward on the 28th of December. The patient later was confirmed. Previously, a family member of that patient has been confirmed. We have started contact tracing. As Dr. Chiang said, we have identified 2 more patients as well as 2 staff members who have been confirmed cases. There are 40 or so patients who have visited the same daycare ward to receive treatments. Most of them are hematological patients. They are classified as close contacts and they will have to go through quarantine. There are 20 or so staff members who've worked in that ward. They are also classified as close contacts. They also have to go for quarantine. Dr. Chiang has mentioned about a mandatory testing notice. We will dovetail our work with them. Staff members who don't fit the criteria set out in the notice will receive other arrangements. We have asked Professor Yun to visit the hospital to try to identify the transmission chain as well as the source. Professor Yun, after his investigation, will meet with the media at Princess Margaret Hospital to give you his findings. We think that some services will be affected. We're trying to find ways to minimize the impact on patients. We ask for your understanding. That's all for my report. Now it's question time. Please use the microphone. Limit your questions to no more than 3. Identify yourself as well as the organization you represent. The lady in brown. I'm from Now TV. First, I'd like to ask. Yesterday there was an announcement saying that the press briefing on COVID will be conducted online. In less than 1 day, it's changed back to a physical press conference. Why? You did not want us to ask questions? Within 1 day, you change your decision again. Does it mean that the decision previously was a wrong one? I'd also like to ask about large-scale testing. Well, in Shamshui-Po, there was a contractor who simply did not show up. Which is it? Which contractor is it? Will there be penalties? Will there be consequences? When were you told that they would not be able to deliver the service? Just now, the secretary said that they are working with the Innovation and Technology Bureau to develop an internal information platform. Does it include recording on a mandatory basis the whereabouts of citizens and to mandate the downloading of Leave Home Safe app? Well, will you be minded to train the staff you have in mind responsible for tracing to conduct sample collection as well? The new arrangements announced by the Department of Health is a joint decision by the Information Services Department as well as the Department of Health. I'll give you more information later. Back to your question about mandatory testing. I myself went to Shamshui-Po to conduct an inspection. We would like to expand the scope of our testing, especially at buildings with a certain level of risk. That's why we have lowered the threshold to expand the scope of mandatory testing. At the same time, about 40 or so buildings have been included under the mandatory testing notice. Currently, there are service providers in the form of contractors providing such service. Where there are small-scale outbreaks or clusters, we would like to provide maximum convenience to residents affected to get tested. They can go to 47 general outpatient clinics under the hospital authority, 121 post offices, as well as 21 train stations to about 40 or so sample collection have been included. On top of that, we have set up mobile sample taking centers. I'd like to thank the Home Affairs Department as well as district officers of various districts for their detailed arrangements to make it happen. So far, the operation of these mobile sample collection centers is smooth. Contractors have to consider various factors of their own when deciding to set up mobile centers. Of course, we would like to provide convenience as soon as possible and as far as possible. We have been keeping the public informed that testing could be done on the 3rd and the 4th. The Home Affairs Department has been trying to map out the details. If the testing center is some distance from the building blocks involved, they will arrange transportation to take residents to the testing centers to get tested. We have been in communication with contractors. We aim to provide convenience to citizens to receive the testing. Regarding tracing of close contact, I will defer to the Center for Health Protection for details. You talk about the information platform. The objective of this platform to enhance contact tracing efficiency. It also aims to speed up the process. I'll defer to the Center for Health Protection for details. Now I'll first defer to the director. As I've said, different contractors have different considerations of their own. Say, for example, when they are able to set up these sample collection booths, whether they would be able to take up the job. Well, we all want to set up these booths as soon as possible. In relation to dissemination of anti-epidemic information, we have been trying very hard. Every day we make use of the daily press briefing at 4:30 to disseminate the latest situation about the epidemic. We've always wanted to use different ways to implement social distancing measures. We have been considering using an online platform to conduct the press briefing. There were 4 confirmed cases in government buildings. That's why we wanted to speed up our work to enhance social distancing measures. We've drawn reference from other press briefings, say for example that of the Consumer Council, which is done online. We made a decision to change it to an online platform, but there are some technical difficulties. Say, for example, in relation to the sound feed of simultaneous interpretation. We have considered the situation and decided to revert to the physical form of the press briefing.
For contact tracing, Dr. Chiang or Director, and on the information platform for close contact tracing, and the FHP and the other departments have been collaborating, and the hospital authority as well, and also we're working on the platform as well. And for the platform working with the HA, we already set up at the next stage the other relevant departments, for example, some information, for example, the ID number, whether it can be uploaded or rapidly located, the address and the telephone number. Well, this information platform can expedite the location of the close contact and the cases. And on the 4th row, TV news. First on the measures. Well, for the secondary school allocation assessment exam at the DSE will also be delayed. Would we need to abolish the oral exam like last year? And you meant that all the measures will not be lifted until achieve zero infection. So how long do we have to wait? Or do you think that you're not seeing any solutions? For the Princess Margaret Hospital cluster, for the 4 preliminary cases, and how do they get infected in the hospital? Let me take the question on the DSE exam. The latest arrangement of the Hakka DSE, well, we already announced it way earlier. For example, on the 23rd of April, excuse me for any mistake, I suppose it's the last from the end of April to end of May, and the Chinese and the English oral exams had already been cancelled. Well, by making advanced arrangements so that allow the better student to better prepare for their exams. And for the secondary school allocation exam, and on the 15th of January, they need to provide the student score to the EDB. I heard that most of the school are ready. And if some school come into problems, we can consider their individual circumstances. And for the secondary school place allocation exam, and since it won't happen till April, we will keep it in close view. And today's measures would that without affecting their overall school safety, we give some schools some flexibility to hold classes or some exams, and hope they can help the school in this regard. So I will still talk about the measures, and I'll pass on the HA to talk about the Princess Margaret Hospital. As we know that the COVID-19 is still raging around the world. And whether they are global figures, the number of new cases, the mortality rate, or even some European countries or some Asian countries, their daily confirmed cases are reaching new highs. And now that it's winter, the virus, as we found, had developed variants and also become more and more transmissible. On one hand, we have our contingency measures, our strategy. It contains three aspects. One, we need to prevent import of foreign cases. Globally, the virus is still raging. Preventing importation of cases is the key. And for example, the new measures over the past year, and also prevent the spreading of disease in the community. And our testing capacity, our facilitation, our scope, and the compulsory testing, also for contact tracing, we'll be adding more manpower and strengthening measures. And our quarantine and isolation facilities are to prevent, for early isolation and treatment and prevent the spread. Third aspect, social distancing measures. Besides closing some premises to reduce the flow of people, we hope that the public should continue to bear with us and keep up with the cooperation to reduce the flow of people at a manageable level. Referring back to the 7 days moving averages, our measures are proving to be effective, and we can see the cases are slowly declining. However, the speed is very slow. And coupled with the untraceable cases, it still made a 1/3 of the total. And some of the clustered, whether in hospital or the early United Christian Hospital cluster, and now the Princess Margaret. And yesterday, the workers at the tunnel construction site, and you can see quite a number of cases involving. These cases are telling us that whether for social distancing or personal hygiene, we still have room for improvement. Why is that we still need to improve? I have shown you the octopus mobility data. We failed to see the mobility to decrease when we have the work at home arrangement in place. And also social distancing measures covering various kinds of premises are still ongoing, that these declining had failed to match to the height of the previous wave. Therefore, we still need to work on this. These measures are still effective, though. Whether we need to strengthen them and hope that we can hope that the cases will decline more rapidly. It all depends on public cooperation. Hospital authority. And for the Princess Margaret Hospital daycare ward outbreak, at this stage we found 2 patients and 2 of our colleagues are preliminary positive. The CHP and the Princess Margaret Hospital are conducting a detailed investigation. And also invited Professor Yuen Kwok Yong. He is now at the hospital working with our colleagues to investigate the possible transmission route and how our colleagues and patients get infected and what are the improvement measures. And our colleagues shall meet the press and give an account of the investigation results and other findings. Let's take an English question.
嗰邊第三行最左。
On your third row.
Thank you. I'm from RTHK. So my first question is for Mr. Kevin Young. So could you explain the rationale for extending online lessons for another month when the number of COVID infections is decreasing? And is there any standard for students to go back to school after Lunar New Year, for example, single-digit infection per day? And second question is for the hospital authority. Could you Could you explain some possible reason for the transmission at the Princess Margaret Hospital? Because you said that 2 of the staff had to be quarantined. Did they wear suitable PPE or did they carry out high-risk procedures? And also, did the patient wear mask properly? And how many close contacts will be sent to quarantine or tested mandatorily? And final question about the daily COVID briefing. Could Department of Health explain what prompted this decision, moving the briefing online after the physical briefing has been going on for almost a year? And did the authority consult medical experts before deciding moving the briefing online? Thank you.
Secretary Young, please.
Yeah. When we consider whether we could resume face-to-face lessons, we have to take into account a number of factors. And it also has to tie in the overall situation of the pandemic as well as the overall government strategy on social distancing. As explained by the Secretary for Health and Food Safety before, that the overall strategy now is to maintain the social distancing measures for another 2 weeks. And it's also possible that there could be no relaxation before the Chinese New Year. And so when we decide whether we should resume class suspension, we take all this into account. And given that there is a very high chance that there could be no relaxation of social distancing measures in the coming weeks, we decided to extend the current suspension until the Chinese New Year, because we wish to give the schools as well as the parents some sort of planning for a longer term. For example, when we talk about the measures, we talk about today about allowing different classes of different forms to go back to school. It's better for school to have a longer term planning instead of week by week. They now have about 4 or 5 weeks period that they could plan over that period, which year of students could come back first, and all this of arrangement, and how the curriculum or how the school lessons should be structured to allow the study from home as well as the face-to-face lessons to sort of tally with each other. So that's why we sort of now decide that we have to continue the suspension of face-to-face lesson until the Chinese New Year.
Dr. Koh, please.
The Princess Margaret Hospital is being informed that a patient who has attended the medical day ward on the 28th of December last year was diagnosed to have COVID. In view of this information, we started to conduct investigation and contact tracing. During the process, we initially noticed that 2 patients and 2 staff was preliminarily found to have positive results for COVID as well. At the moment, we are still conducting investigation with the experts from the Center of Health Protection and the hospital infection control staff. Our initial findings show that the index patient, that is the patient who attend the day ward on the 28th of December, there's no specific aerosol generation procedure or high-risk procedure that has been conducted for that patient. And in general, the staff and patients are generally comply with the infection control measures. We are now still in the process of looking into the case in details, as well as the scenarios where the two patients and the two staff has been involved, whether they have taken care of the patients and the overall environmental condition. We have also invited experts from Professor Yun to come to the hospital to help us to look into the case details and try to work out the causes of the infection outbreak in the day ward, as well as to recommend measures to further improve the conditions. The investigation is still ongoing at the moment, and our colleagues in the Princess Margaret Hospital will conduct another press conference to report on the details of the investigation findings later today.
Dr. Chan, please.
Government all along attaches great importance to risk communication with the public. And this is done, for example, through the 4:30 press conference conducted by colleagues from the Department of Health, Center for Health Protection, and the Hospital Authority. We've always been looking for measures to tighten up infection control by, for example, tightening social distancing measures. So we have all along been looking at measures or means to improve these areas. So one of the measures we contemplated was to introduce online press conference, having taken reference to the press conferences online conducted by other public bodies, for example, the Consumer Council. We were in particular prompted by the recent outbreak involving 4 staff at the buildings of the Center for Health Protection. So we would like to implement some tightening of social distancing measures. So we attempted to use online press conference, but having heard the concerns expressed by the community, so we have decided to implement back the real press conference until we can resolve the technical problem related to the sound. The problem right now is the sound supporting the simultaneous interpretation systems. So until that can be resolved, we would continue to do real on-site press conference.
好，下一條。呢邊第三行最
Next question. The lady on the left here.
Question is for Secretary Chan. Considering you mentioned that over the festive period, and based on the octopus data, you still see that many residents are going out, and you earlier also mentioned that there is not really a chance of lifting any social distancing measures until at least Lunar New Year. Considering that there's still obviously a lot of social activities going on, would you consider more stringent measures such as lockdown or, as previously suggested, shortening operation hours for malls or any such measures? And my second question is about the PMH outbreak. This is the second hospital outbreak in less than 2 weeks' time. Does it show that the current infection control measures are not stringent enough? And would it be possible that the hospital authority might further reduce non-urgent services at public hospitals? And my final question is about the Chiang Lam Tin Tunnel outbreak. And this is the second outbreak there as well. And what further measures could the construction site take to avoid further transmissions? Would you suggest specific measures targeting changing facilities? And as well as, I would also like to ask if the work suspension is going to be applied to the entire construction site or just the specific part that's currently affected. And also a follow-up on how many preliminary cases there are for tomorrow or today. Thank you.
Professor Chan first.
Okay, thank you. Thank you for your question. As far as social distancing measures is concerned, actually, you may recall we have put in a very stringent set of social distancing measures early December, and we have extended the social distancing measures on the 24th of December, the same set. But then while we think the social distancing measures are generally effective because we see, together with the efforts, other efforts of border control measures, expanding testing, compulsory testing, contact tracing, and also isolation and quarantine. The social distancing measures, together with a basket of these measures, have actually made the number of cases, if we look at the 7-day moving average, has gone down. But then the fact that if we look at the number of cases going down is not as fast as we would like to see in terms of the overall downward trend. Coupling with the number of unlinked cases, we still see about 1/3 of the cases. Again, there is a downward trend of the unlinked cases. But given the situation again is very slow in terms of the downward trend, so therefore we felt it is very important to maintain the social distancing measures. As you have already alluded to earlier, you asked questions about the outbreaks in the hospitals. There are also outbreaks in the construction sites, the tunnel, and also the mobility data that I have shown on the MTR that shows that there are still lots of activities, going on in the community despite of the work from home and other activities. While I can understand, people may be impatient and also fatigued, but unless and until we all work together in sort of reducing people's flow, I'm very worried that these clusters and these outbreaks may continue. And so we do not want to see any rebound or resurgence of the cases, because the whole healthcare system and the whole government have been working very hard to bring this down. We just want to continue to bring down these numbers, and we require the cooperation of everyone so that we can fight the virus together.
Dr. Ko, please.
In the hospital authority, we pay a lot of emphasis on the importance of infection control. As mentioned by Professor Chen just then, we are aware that there are still many COVID cases in the community. There are a number of cases reported every day recently, and also there are quite a substantial number of unlinked cases, many asymptomatic cases, as well as cases what people call invisible patients, or patients who are hidden with no symptoms or signs. So it poses great difficulties in the hospital because a large number of patients attend the hospital every day, and we have to have very good infection control practices. That's why we have been very careful in implementing various measures throughout the years, and especially in the last year when we first have COVID in Hong Kong. After the recent outbreak in the United Christian hospitals, we have already shared with the public and the press that we have implemented a number of measures, which I mentioned in another press conference last week. We have introduced repeat tests for symptomatic patients after hospital in 2 days' time, minimize intercubicle transfer, and we have also arranged testing for visitors to hospitals and asking them to wear the appropriate PPE, as well as adding more and more use for one's medical equipment to minimize the need to share equipment among patients. So a large number of measures has been in place to further improve our infection control system. Apart from that, last week we have also conducted another expert group meeting, task force meeting, to overall review our infection control practices, how we compare with overseas international guidelines and the practices in different parts of the world. We are, from our assessment, we are aware that the way we do infection control and our practice are generally suitable for the present situation when compared to overseas guidelines, as well as asking opinions from the local experts in the universities. On the whole, we believe our infection control practices at the moment are adequate, but of course we take the opportunity to remind our colleagues to pay extra attention because, as I mentioned just then, there are quite a number of patients in the community that do not have symptoms or signs. So we have to be very careful and take extra precaution when handling the patients. Regarding whether there's a need to further adjust our non-urgent services, I think the Princess Margaret Hospital investigation, after we know that the details, after the exact number of staff that will be affected, then we need to be arranged to quarantine we will have a better picture as to the potential impact. At the moment, we are expecting that some services may be affected, in particularly those who are that is non-urgent services. But I think we need to have a better picture of what's the details of the extent of the impact of the PMH cases before we can draw conclusions.
Dr. Chan, please.
I think the construction site workers, because of their job nature, it's very difficult for them to comply with certain infection control measures, such as wearing masks because of the heavy manual labor work. And one of the features we found in this outbreak and also the past outbreak is that they usually use some containers as changing room, restroom, as well as the place for taking meals. So I think in future, maybe the authorities may wish to consider space out these containers or changing rooms and minimize the number of persons sharing one changing room and providing more spacious place for them to have change or rest or having meals. And they may also like to explore whether it's necessary to introduce regular testing.
最後兩條。
Last two questions. The fourth row, the right nose reporter. HK01. Just now, the Director of Health mentioned that the physical press briefing and due to the audio technical difficulties, therefore, they resumed to face-to-face physical briefing. Does that mean that once you address the audio difficulty, that the 4:30 briefing will go online? And when will the new measures take place? And so that press briefing will conduct at the CGO, and when we have held a lot of press conferences in the CGO, does that mean that over the past year that public officers and the journalists have been in a high-risk location, while other departments will continue to maintain their physical press conference arrangements? And for Princess Margaret Hospital situation, now that we have 2 staff and 2 patients confirmed, have you find out whether the patient are sharing the same cubicle with the confirmed cases? And did the medical staff have performed sound infection control measures and any high-risk procedure have been performed? And for the Chiang Olympian tunnel, we heard now that we are seeing more cases. So far, how many confirmed cases have been using the same container to take rest or take meals or changing their clothes? Is it possible there's a transmission inside the containers? You went over 3 questions. And maybe Director of Health can take the question on the press briefing first. We hope to minimize the transmission risk. And for infection control measures, we hope to strengthen all of them. Recently, we explored the format of an online press con and took reference to other public organizations. They have tried online press conferences. After addressing the audio difficulty, we'll reassess the situation. And due to your concern, the physical briefing shall be maintained for now. Dr. Tony Ko. And for the Princess Margaret daycare ward outbreak, as we know that a patient who had arrived at the ward on the 28th of December will be confirmed with COVID-19. Subsequently, we have conducted contact tracing, and so far, we have 2 staff and 2 patients preliminary positive. When the patient arrived at the hospital for treatment, so far, an investigation did not highlight any special circumstances. For example, no high-risk procedure or any aerosol generating procedure. It seems from what we know that the 2 other colleagues were not particularly close contacts or performed any high-risk procedures. The CHP and the PMH infection control team are conducting a detailed investigation at the site to hope to yield more clues and also conduct further analysis. We also invited Professor Yun to the PMH to conduct a detailed investigation. hopefully to identify the possible causes and also to offer recommendations to do a better job on this. And for the relevant results, once they're ready, will be explained to the public at another press conference to be held today. Dr. Chiang? For the tunnel construction site, we have 12 cases so far. They belong to 3 different companies. Thus, not all of them had used the same changing room. Some of the workers have shared a container with changing room for 10 to 15, while some containers only used by 5 to 6 workers. Besides a container being the transmission risk, there may be other transmission routes in the construction site. Well, in the changing room, of course, there is plenty of contact, and there will be some hidden transmission chain. Therefore, we suggest to issue a compulsory testing notice. And the reporter on the 4th row at the right. Cable news. And a question on the press briefing. Well, just want to clarify. Well, the press release explained that holding this press conference at the CGO is to address social distancing, and you claim you yet to resolve the audio difficulty. So what's the real reason to moving to online and then moving into the CGO? Does that mean that you won't rule out that you will move the press briefing online? And whose decision was it to move it online, even though you claim that it's a joint decision by the Public Health and the ISD? Do you have a hand in this? And have you we consider apologizing to the media organization for the chaos caused? A question for the Director of Health. Would the social distancing measures be relaxed only when there is serious infection? Would you act upon Professor Yun's recommendation on treating the close contacts of the close contacts, such as 2 tests in 14 days? Question for Secretary for Education, Mr. Calvin Yang, on the suspension of face-to-face classes, and yet you allow some grades to attend half-day classes, and you claim to in order to avoid students going out for meals. And if you avoiding preventing half-day classes, and what do you mean that? Why do you think the student won't go out for meals after half-day classes? How measures will you take to reduce cross-infection? The online arrangements for this press briefing, we hope that we can strengthen the infection control and enhancing social distancing. And we take reference to other public organizations. For example, the Consumer Council had adopted a similar arrangement, and the Department of Health and the Center for Health Protection, we had 4 colleagues diagnosed with COVID-19. Therefore, we hope to strengthen our measures to reduce transmission risk. I have been part of the deliberation, and after making an announcement, and in light of the public concern, we immediately revisited the matter and respond to the demand. We have decided to resume face-to-face press briefing. We'll closely monitor the epidemic, and since that there's a huge demand, we'll continue with the physical press briefing. Secretary, on one hand, we are determined to achieve zero infection, and whether to prevent the import of cases, we have been very stringent, especially for the variants in foreign countries. For high-risk countries, and if the persons have spent more than 2 hours in those countries, will not allow them to board. And also, the quarantine period has now been extended to 21 days, and we have different line of defense through testing. For example, they need to provide a negative test result before boarding, When they arrive at the airport, they need to test and hold. And also we have changed to swabbing tests. And during the quarantine period, and on the 12th day, on the 19th and the 20th day, we have added extra tests in order to achieve almost watertight. This all have been strengthened, and also we have the designated quarantine scheme at dedicated transport and the all-round tightening measures on confinees. Another aspect of our work that we can strengthen, that we should hope to curb the number of new cases, and that's what I refer to testing. And over the past month, we have performed over 1.6 million tests under our three-pronged testing strategy. For compulsory testing, over 500,000 tests. And for the necessary tests on targeted groups, we have also performed over 500,000 tests. And for the voluntary tests for the individuals who are concerned and hope to get tested on their initiatives, it's almost 500,000. The testing capacity, we hope it can get boosted. However, when it comes to the implementation details, if we can expedite the process and more comprehensive and making good use of our existing capability, and we shall continue to take this forward. Your question also mentioned about close contacts. The CHP has been working very hard in tracking down close contact, as we know that there is some difficulty. For example, we need to question the close contacts or the patients, and also they require a large amount of manpower, which we already try to strengthen the manpower. And besides the close contact, if we need to track down the close contacts and the contacts of the close contacts, these multiple layers of tracing would need more manpower. And now the Chief Secretary is leading an interdepartmental task force to comprehensively strengthen our work in this area.
Mr. Young. Since the start of the epidemic, schools have been maintaining half-day sessions. As a lot of experts have said, that schools is a small community. If people inside take their masks off to eat, then there is a higher risk. We use half days as a standard in terms of face-to-face classes, because we want to avoid students having to take off their masks to eat. The maximum number of students allowed per session is 1/6 of the total number of the student population, and the length of the session is limited to half day. Face-to-face classes are affected, just like other activities, say for example restaurants, in which only 2 people are allowed at each table. We have to try to control the epidemic, and that requires the work of everyone.